Coffee. I am Mark Cook, and you are on the Radio Vision Network, and we are super excited because on the line, I have two very special women that I can't wait to talk about. The first is Dr. Susan Joseph. She is the advanced heart failure cardiologist in Dallas, Texas, and Jessica Rogers from Seattle, who is an advanced heart failure survivor and first place winner of the Mended Hearts St. Jude's National Video Contest. Good morning, ladies, and welcome.
Good morning. Thank you. Thank you for having us. We're so excited to be here.
I'm excited to have you. This is such a cool thing that you guys are doing because, listen, there's like 5 million people out there that are living with heart failure, right? There's treatment for these people, but they don't know about it. So Doc, tell me what's going on here.
Well, there are 5 million, probably close to 6 million Americans living with heart failure, and LVADs are specifically for patients with severe heart failure for whom medicine doesn't work anymore. They're surgically implanted pumps that restore circulation. So imagine a person who is profoundly ill, oftentimes critically ill in the ICU or in the hospital, or even less so at home, but completely disabled from their heart failure, unable to empty the dishwasher, unable to tie their shoes, unable to enjoy life without shortness of breath or exhaustion. And these pumps are absolutely transformative. I've had patients return to the gym, run 5Ks, return to work, travel outside the United States. Jessica here is a perfect example.
Yeah, this is a game changer. This is such a cool technology. I'm actually kind of like blown away by it because this medical stuff sometimes goes a little bit over my head, but doctor, this really could change the entire landscape of how we deal with heart failure. It takes the transplant off the table, doesn't it?
It's not yet. Maybe one day. A lot of experts think that it will take the transplant off the table one day because there are not enough transplants for everybody. You know,
right.
Of the 100,000 I mentioned, there are only about 2,000 transplants available every year in the United States, and that number is not increasing. But guess what? We can manufacture LVADs, and there's probably no limit at this time. So the sad thing is that we're only implanting about 2,000 to 2,500 LVADs every year when we really could be helping 50 or 100,000 patients right now.
Right.
So
now, I want to talk about those
awareness.
I'm sorry. I want to talk about those LVADs for a second because that's where Jessica really comes into play here. Because Jessica, you are a survivor, right? You have gone through, kind of some tough time, but you are on the comeback trail, and then you saw this video contest. So tell me a little bit about your journey through this.
Yeah, definitely. Like you said, it's mind-blowing, and I'm here to tell you that I'll never get used to knowing that there's this mechanical device inside of me, pumping my blood for me and keeping me going. It's just incredible to be able to breathe and be here and live. And I entered my video into the contest simply because there's just not enough people out there that know about LVADs. Like the doctor was saying, there are many more people that could potentially be helped with this type of device. And I'm here to tell you today that I could not even lift my head up off the pillow, and now I'm sitting in New York talking to you and living life and enjoying life, all because of my LVAD.
Well, it's awesome, and congratulations, and we're so happy to hear that story because, look, you're a young woman. You're 28 years old right now, and this kind of came about at a time where you shouldn't necessarily have to be worrying about such a serious medical problem, but your persistence and your, I guess your fight was not going to allow you to, to approach this any differently than the way you did.
Definitely, yeah. I did not let life hold me back, heart failure or not, and I wanted to put my video in there and let people know that, I said in the video I was able to go fishing in Alaska and, meet the love of my life, and we're getting married. And just, there's life even with heart failure. And to give, just one person the hope that it's doable.
it's awesome. Your story is so inspiring, and congratulations on winning the contest, by the way. That's pretty impressive as well. But my question, and I don't know, Doc, maybe if you're better for this, but why did Mended Hearts and St. Jude's, why did they want to come up with a contest like this?
I think it's I happen to be one of the was selected as one of the judges of the contest, and there were over 250 entries, and I got to tell you, it was absolutely gratifying to see people talking about their own devices, and I think that was the beauty of the awareness campaign, is that so much of the time you hear about therapies from doctors or from spokespeople or from commercials, and what's so cool about this is that you got to hear about the therapy from patients, which is so heartwarming. There's no secondary gain there. This was voluntary. This was out of passion, and it was just. I got to tell you, Jessica's video made me cry. I'm embarrassed to say it, but
no, don't be embarrassed. I'm sure it's very emotional. These are very emotional, personal stories that these people were telling, and they were basically praising the medical technology that is now available to people that have been suffering with heart failure. Dr. Joseph, I think that this is amazing, and don't look down on the fact that you cried. I would embrace it. These are powerful, emotional stories.
You hit it right on the head. So bottom line, it was to raise awareness, and I think that Mended Hearts saw the opportunity to do that in a very powerful way that would connect with people.
Yeah, it's really an awesome thing, because look, I knew a young woman who passed away at a very young age because of a heart condition. Your heart is just as important as any other vital piece of your body, and you need to take care of it. And if you have an issue,
more important.
Yes.
The most important, but hey, I'm biased.
Well, listen, for the sake of this interview, yes, it is the most important. And you need to understand that heart failure isn't something that you can mess around with, and that there's another alternative now. So ladies, how can people watching? I got a lot of people watching and listening right now. How can people participate?
Yeah, head to the website thinkslvad.com. You can learn more about what exactly an LVAD is. Watch my video and the rest of the winning videos. Really get a feel for how, like you were saying, how passionate people are to have their LVADs. I am so incredibly blessed and thankful to still be here, and it's all because of my LVAD. I would not be able to talk to you today without this amazing device. Yeah, you can head to that website, thinkslvad.com, click the share button, share our videos, get the word out there, let people know that this is available.
Yeah, this is a total game changer. It's so awesome. I'm so glad that I got the chance to be able to talk to you ladies. Doctor, you're doing amazing work down there in Texas. Keep up the great work.
Thank you for this opportunity. Love talking to you. Thank you very much.
Yeah, you're quite welcome. Love talking to them too. That was Dr. Susan Joseph and Jessica Rogers. Listen, ThanksLVAD.com. Go check out that website. You're going to learn more about this totally revolutionizing medical technology in the field of heart failure. You need to check it out. ThanksLVAD.com. Thank you to Dr. Joseph and Jessica Rogers for joining us. I am Mark Cook. I got to take a quick break here on Morning Coffee, but we'll be right back on the Radio Vision Network.